Bloodborne pathogen training. My name is Darcy Crosstone. I will be going through a presentation regarding bloodborne pathogens, which is a very important occupational safety and health administration topic that most facilities require their students to have training on prior to the start of their clinicals. What are bloodborne pathogens? They are pathogenic microorganisms that are present in human blood or other potentially infectious materials and can cause disease in humans. The bloodborne pathogens that we'll discuss today are hepatitis B, the human immunodeficiency virus, and hepatitis C, although there are many other bloodborne pathogens out there. Hepatitis B can lead to cirrhosis, liver cancer, and death if left untreated. It also causes scar tissue. The vaccine for hepatitis B is given in several injections over a 6-month period. There are medications to help treat chronic hepatitis B infections. However, they generally do not work for everyone, and this is why prevention is so important. HIV weakens your body's defense to infection, and this is the virus that causes AIDS. Hepatitis C is the most chronic bloodborne infection in the U.S. It can lead to cirrhosis, liver cancer, or death, just like hepatitis B can. It also can be the cause of malaria. There is no cure for hepatitis C. Bloodborne pathogen exposure happens more commonly than you may have thought. OSHA, the Occupational Safety and Health Administration, estimates that 5.6 million workers in healthcare and other facilities are at risk of exposure to bloodborne pathogens such as HIV and HBV. So who is prone to exposure? The OSHA standard states that all employees who could be reasonably anticipated as the results of their job duties to face contact with blood and other potentially infectious materials are at risk. Exposure determination, this includes jobs in which exposure to blood or other body fluids can occur. So a little bit more specifically, in the healthcare field, who is at risk? The workers, such as the physicians, nurses, direct patient care, such as radiology techs, phlebotomists, waste management, environmental service workers, and first responders are all at risk. Exposure could be anywhere. The most common form is from needle stick exposure. Also, you could get exposed from cuts from other sharp objects and also come in contact with the bloodborne pathogens through the mucous membranes, like your eyes, nose, and mouth, or through broken skin with contaminated blood. Standard precautions are used to protect employees from exposure to all human blood and also other potentially infectious materials. So when dealing with bloodborne pathogens, you need to treat all human blood and body fluids as if it is infectious. It can be spread through direct or indirect contact with infected blood or other bodily fluids through any opening in your body or break in your skin. Standard precautions include proper hand hygiene, so making sure that you're using proper sanitation and hand washing techniques, engineering controls, use of personal protective equipment, work practice controls, proper equipment cleaning procedures, and also how to properly clean up spills. The OSHA Exposure Control Plan identifies jobs and tasks where occupational exposure to blood and other potentially infectious materials can occur. The exposure control plan includes jobs in which exposure to blood or other bodily fluids can occur, which, remember, this is known as exposure determination. It includes training requirements for employees who could reasonably be exposed to blood or other bodily fluids as part of their duties. It involves safe work practices, procedures, tools and equipment to help guide and protect you, which are known as controls. And it also includes procedures for evaluating details of exposure incidents. So each facility has their own plan that provides the use and description of personal protective equipment, training methods, medical surveillance, signs and labels, and the hepatitis B vaccine. It is absolutely essential that you are very familiar with your clinical site exposure control plan for bloodborne pathogens. Remember, the employer's exposure control plan can only work if you know how to use it correctly. Engineering controls are tools provided by your employer that help in the protection of bloodborne pathogens. You should use the tools your facility provides, and you need to talk to your supervisor if you have any questions about when and how to use the tools. Engineering controls include hand washing facilities, which may include eye wash stations and foot-operated sinks and soap dispensers, personal protective equipment such as disposable gloves, gowns, masks, respirators, and goggles, sharp safety devices such as needleless IV systems, syringes, and shielded needles, and also the self-sheathing needles fall under this category. It includes sharps disposal containers. These are often found in the radiology department and even in the patient's rooms where there is any area where the needles or disposable medical equipment should be used. Some restrooms may have a sharps container mounted on the wall or counter for disposal needles used by a person requiring injections, such as insulin. And another example of an engineering control is the use of bags or containers marked with a biohazard symbol. This is for materials that are infected with blood or bodily fluids. These are often seen as red bags or containers and are used to identify the contaminated waste and may or may not be marked with the actual biohazard symbol. Just the use of the biohazard symbol and other labels and signs that identify the work areas where infectious materials could be present is another example of an engineering control. The use of cones and other markers to clearly identify areas where an incident has occurred is another. Moving on to work practice controls. These are designed to keep you safe on the job and to protect you from exposure and infection. They include washing your hands, wearing the personal protective equipment properly, the handling of needles and other sharp objects in a safe way, properly cleaning and disinfecting surfaces and equipment, cleaning up blood spills properly, never storing food, drink, or other personal items in refrigerators or shelves or in other places where blood and other bodily fluids are stored, and as well as not smoking, eating, or touching your eyes, nose, or mouth after getting someone else's blood or body fluids on your hands. So I've mentioned personal protective equipment a few times throughout this lecture already, and I want to go into a little bit more depth in this slide. They are protective barriers that help you protect your skin, eyes, mouth, and nose from blood and other body fluids. They should be used where exposure risk still remains after the engineering and the work practice protocols are already utilized, and this could include all specialized clothing, equipment, and supplies that you keep from directly contacting the infected materials. So this could include gloves. Remember that it is absolutely essential to wear disposable gloves whenever you may have contact with blood or other bodily fluid, broken skin, or mucous membranes, such as in venipuncture. You should always wear the gloves when touching any item that may or may not be contaminated, even if you're not sure. Before wearing the gloves, make sure you wash and dry your hands, cover the cuts, scratches, or scrapes on your body with bandages, and remove all jewelry if possible to prevent any tears in the gloves. Make sure you remove the gloves right after you use them. Remember to wash your hands and put on the clean disposable gloves between procedures. Other examples of personal protective equipment, moving on, are gowns, face shields, eye protection, and any mouthpieces or resuscitation devices, which are used usually in CPR breathing techniques. Make sure you remove your personal protective equipment properly as well. So discard disposables into the biohazard container. For example, right after you remove your gloves and other disposable items, make sure that they go straight into the special biohazard containers that are marked specifically for them. Put the reusable equipment in the proper place. Ask your supervisor for details regarding the location of each container. Remember, reusable gowns and other linens should be placed in a marked laundry bin. Always remember to handle the sharps containers and sharps safely. First and foremost, just be careful. Always move carefully when handling sharps to prevent exposure to blood and other bodily fluids. If you have not been trained in the handling of sharps, simply ask for help and report the incident. Make sure you dispose of any sharps in a puncture-resistant container, so never throw sharps in the trash. You should dispose of them in a marked puncture-resistant container as soon as you're done with them. Containers for sharps disposal will be provided by your facility, so make sure you know where they are. Make sure that your facility's guidelines to start the disposal of sharps containers usually should be taken care of when they are 2/3 of the way full. Never force a sharp into a sharps container, and be careful and watch as you place the sharps into the container. Make sure also that you never reach into it, and never open, empty, or reuse a sharps container. Moving on, don't bend, break, or recap needles. Never use needles from the disposable syringes. Make sure used sharps don't get left on a sheet or in the linens, because those do not go into the sharps container. Those go into the laundry bin and can easily poke someone. Just remember that trash bags may contain sharp objects, so don't pack them down with your hands and don't swing them near your legs. Always look into a trash container before reaching in to retrieve something. Empty the trash onto newspaper, or maybe search with your eyes instead of your hands. As far as housekeeping goes, make sure that work surfaces are decontaminated with the appropriate disinfectant. This should be done after the completion of any procedure, at the end of your shift, or when you see that any work surfaces are contaminated. Remember that regulated waste must be kept in closable, leak-proof containers that handle, store, and transport bloodborne pathogens. And make sure that these waste containers are properly labeled or are color-coded. Remember that contaminated laundry should be handled as little as possible, and it has to be bagged or containerized at the location that it was used. So what do you do if an exposure occurs? Let's talk about what happens during the incident. First, you need to check the scene. When you check the scene, always remember to remain calm and do not panic. You should first determine if your injuries are life-threatening. Then, if they are, you need to call 911. Next, you need to protect yourself. When helping an injured person, make sure you protect your hands, mouth, eyes, or any part of your body that might come in contact with the person's blood or bodily fluids. Next, you should control and flag the area. If the contaminated area is left unmarked, other people can then be exposed if they are unaware. Follow your work practice controls and use the materials that are provided, such as rope, flags, cones, or tape to mark off the incident site. This will help others from becoming exposed to any blood or bodily fluids. Then you need to make a report, and this needs to be done immediately. Just report it to your supervisor, and also remember to list anyone who has witnessed or was involved in the incident as well. After the incident, make sure that it is cleaned safely. You need to properly remove any personal protective equipment. Remember, take off your clothing by carefully peeling it away from your body. Put the clothing in a biohazard bag for proper disposal or for proper cleaning. Remove your gloves last by following the steps described previously in the lecture. Dispose of your gloves in a biohazard bag and do not throw them in the regular garbage. Remember, always wash your hands after removing your personal protective equipment.